I was about 8 years old when I realized that I had a weight problem. I went to the pediatrician. The pediatrician let me know that I was overweight. My name is Germarie. I'm 29 years old and I live in Vacaville. I was actually being watched very closely for both my pregnancies due to obesity. My mom was concerned with me being comfortable, and so we were talking about amusement parks, which was a favorite thing of mine since I was a child. She said, "You'll never fit on a roller coaster with your kids." And it was like a bucket of ice water. The thought of never riding a roller coaster with my kids, it just put me in a tailspin. I was in a panic. I needed to find a solution now.
What I do the most often are the Roux-en-Y gastric bypass, which I call the bypass for short, and the vertical gastric sleeve, which I call the sleeve for short.
I had vertical sleeve gastrectomy, which is where they remove 80% of the stomach. Through my insurance, fortunately, I had a PPO, so I had a little more options, and Dr. Gatchett was one of those options.
A lot of people, when they start with me, they're battered in many ways by trying to lose the weight, not being able to lose it, being unsuccessful, being frustrated and feeling guilty for not being able to lose the weight on their own. And she really has gotten to that point where she has to just realize for herself that that number is meaningless and that what she's doing as far as the exercise and the diet changes and living a healthy lifestyle, that's much more meaningful in the grand scheme of things.
The key characteristic that I will look for, and that's really, really important, is the patient's readiness to change or the willingness to change. What some people think is that the surgery is a quick fix. It is not.
The surgeries offer that reset so that when they get the surgery, their bodies actually allow them to lose the amount of weight that they haven't been able to lose without it.
It means that you've tried all the diets, you've tried exercise. They might work for a little while and then they stop working. So if that's the case, you're the right person for the surgery.
I'm at the gym about 4 times a week now because I have to balance with school, my kids, my family life. My husband, I can't speak more highly about that man either. He is my biggest cheerleader, my best friend.
You don't know what it's like to have the surgery until you've actually had it. And there is a degree of understanding amongst people who've had the surgery, of other people who've also had the surgery, of their struggles and what they might be encountering, not just physically, but also emotionally and socially.
You have to be ready, you have to put in the work, and you have to fight like your life depends on it, because it does. I really, truly am just living my best life, honestly.